It's been 5 years since the death of Joyce Echaquan. The Atikamekw mother of 7 died in a hospital in Joliette in 2020, and while she lay on her deathbed, she live-streamed as staff hurled racist and derogatory remarks at her. Echaquan's death and the footage leading up to it sparked outrage and protests, as well as the creation of Joyce's Principle. It's a call to action for the government to address systemic racism while guaranteeing health and social services free of discrimination for Indigenous people. But the CEQ has repeatedly denied the existence of systemic racism in Quebec, ultimately saying the province could not adopt Joyce's Principle. But this doesn't mean the principle is at a standstill.
Regardless, we're not waiting for them to recognize systemic racism because we're already doing the work necessary to stop racism in healthcare. 5 years after the creation of Joyce's Principle, we currently have the support of 47 institutions.
One of those is McGill University's Department of Family Medicine. They incorporated Joyce's Principle as part of their teaching in 2023.
Bottom line, it's about fair, equal, respectful treatment. That the health center should be seen as a place of that, of help, not a place to suffer, not a place to die.
McGill wants their graduates to be well informed about Joyce's Principle so that they can take that knowledge and apply it to their work.
The patient is the expert in the room. The community is the expert at the table. And so we're changing that power dynamic to one that is more inclusive and also more respectful.
Current students say that learning about Indigenous perspectives is preparing them for their future careers.
I'm hoping to work with Indigenous youth here in Canada, and so I'm trying to understand from the perspective of young people in their 20s and 30s and even younger now, what is their reality like as they're seeking mental health care support.
Like, it's been omitted in the past, these perspectives, and it's been so focused on Western medicine, so focused on the biomedical aspects, which are very important, but Indigenous perspectives, I think, are equally important.
The Office of Joyce's Principle says that support from institutions like McGill is a step in the right direction, but that ultimately they can't do it all on their own.
These improvements rely mostly on the motivation and the commitment of a few employees, of a few health professionals who are personally motivated to update and better the outcome of Indigenous health.
Quebec's health ministry says that it's committed to working on cultural safety and health services. The ministry is funding 47 positions for the upcoming year, meant to help facilitate relationships between communities and healthcare establishments.
I need to be ever optimistic because what I see happening, the response that I've seen come from provincial government around Joyce's Principle is that they've rejected adopting it. They don't see an importance of it. They might voice an importance of it, but actions speak louder than words. And we have been on this ride for 400 years. We understand the game.